We're going to transition from our Healthcare Coalition to our CMS work group process. So if you're not here for that part, you can feel free to I guess, leave. But we had a break scheduled in here, but we're going to just keep rolling with the agenda because we have a couple people that are critical to that do need to leave. So we want to be cognizant of their needs so that we can keep moving forward. So what we're going to do is we're just going to start off with kind of a recap, I think, of what we talked about at the last meeting, and that's kind of around what the CMS requirements are. And then we will continue our efforts as we look at our work as a coalition and how we can support healthcare partners around achieving those CMS standards. So as you recall, in September 2016, CMS passed a new federal, or posted in the Federal Register, their new emergency preparedness standards. Those rules were adopted on November 15th and become effective and require compliance by November 16th of this year, which is coming pretty quick, as you know. Spring's almost here, which means summer and fall are going to be right behind. So the deadline for compliance is coming pretty quick. So we as a healthcare coalition are trying to figure out what can we do in our position, in our role, to help our partners achieve that compliance date. So what we're trying to do is work with these work groups to help bring people together, facilitate conversations, allow you to share ideas. So that's a big piece of what we're doing. We're hopeful this spring, 2017, CMS is supposed to be providing a survivor guide book. Hopefully it'll be out soon. I think the sooner the better, because it will help us better understand what those requirements are and what is required to achieve them. So the CMF guidelines apply to 17 provider supplier types. You've got inpatient supplier types and outpatient supplier types, and I probably don't need to spend a lot of time on that because I'm sure you all know that you're probably on this list. So we can skip right over that. If you go through those guidelines, though, you can really identify that it breaks them out into 4 areas. Really, if you look at what the requirements are, there's assessment and planning requirements, there's policies and procedures that support your planning, there's communication plan requirements, and then there's training and testing requirements as part of the guidelines. So we've kind of taken that tact and tried to break out our work and our support along those 4 primary areas. So we have developed in Region 9, we've got a list of resources here that apply to each of those areas. And all this information is available on our website, so you can access some of these things. So if you're looking at your emergency plan and your hazard vulnerability assessment that you have to do, we've got the Region 9 hazard vulnerability analysis that was done a couple of years ago on the website. So it's a resource that you can look at to help provide you some information. So all the things that are highlighted there in the hyperlinks are resources that are available to you that you can access either through the website or through us individually. And as you remember from the last meeting in January, we started a work group process. And on January, we really focused on hazard vulnerability analysis. So trying to provide you with resources and trying to facilitate a conversation around healthcare types, around what that means, how you can achieve that. And then so today, we're going to take the next step around that is around emergency planning. So that's kind of where we're focused today. And then in May, we'll get to the policies and procedures and really try to bring the work group focus around development of policies and procedures. And then we're planning in July to focus around communication plans. So that's kind of the series that we've talked about over the next couple of weeks or a few months for us to come together and facilitate conversations amongst provider types to help them gain the information that they need. So that's kind of the work group process. Another resource that's out there that if you don't know about is the Asper Tracy website. It's put up by Asper and contains a whole lot of information, a whole lot of samples, a whole lot of templates that you can access by accessing that website. You can get the website from us, or you can just type Asper Tracy into Google and you'll find it pretty easily. So what we're looking at is our work group process. So we've established 4 work groups, and we're going to break those out today in a little bit. to have facilitated conversations. And we've got facilitators identified, but the facilitators we've identified, don't take this personal, facilitators, are not the experts. You know, you guys are the experts. The facilitator's role is really to control and manage the conversation, ask the questions that we've developed to kind of spark your brains and get you guys thinking about what resources you have, what resources you're developing, what resources you need. So that's kind of the process. So we've got 4 work groups. We've got the hospital work group, which when we break out, I think we can just meet in the back 2 tables here. Oh, look at that. Well, they're not sitting where they're supposed to be. But we will have cards there. Ambulatory care right up front here. Skilled nursing, maybe on the front panel over here. Clinics, outpatient facilities would be with Susan Joberg, maybe in the back corner of the tables lined up over there. So what we're hoping will happen is the work groups will assign a note taker and a spokesperson, somebody that can capture the highlights of the conversation, and then at the end of the work group session, provide just a short breakout of what the key points were that were identified in the work groups. Pretty simple task. And then we've got a list of questions that we've prepared that we want to try to run through with each of the work groups to kind of help facilitate the conversation, bring your brains out and get you thinking about what you might have had, what you need to have to help you do that. And at the end of the work groups, we're going to come back together and we will have a short report out from the note takers. So that's kind of the plan that we have set today. And so before we break up into our work groups, what we wanted to do is bring up Daryl Ruby, as you know, and he's going to kind of walk through his experience and really share his information around developing an emergency management program.